Hello all. Today's class is on children with special needs. So the designation children with special needs is for children who may have challenges which are more severe than their typical child and could possibly last a lifetime. So children with special needs may have been born with a syndrome, terminal illness, profound cognitive impairment, or serious psychiatric problems. So these children actually need extra support, additional services. They will have distinct goals and will need added guidance and help meeting academic, social, emotional, and sometimes even medical milestones. So physically and mentally challenged children are the children with special needs. So according to the Convention on the Rights of Persons with Disabilities, or the CRPD, children with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments which in interaction with various barriers may hinder their full and effective participation in society on an equal basis. So we can see that they are people who are different from us. They due to their certain physical or mental disabilities, they are not able to function as normal people do. So that is why they are having special needs. So children with disabilities are a highly diverse population. They include children who are born with a genetic condition that can affect their physical, mental, or social development. In somebody who's having a sustained injury, nutritional deficiency, like vitamin A deficiency, blindness, nutritional blindness. So those are things which can lead to a problem, or it can be even a prolonged illness or an infection which can have functional consequences, or exposure to environmental toxins, like we have seen children who are exposed to certain pesticides like endosulfan, who is having enlarged heads, etc. So they have different problems because of their environmental toxins that has led to developmental delays, or even learning disabilities. So children with disabilities also include those who have developed anxiety, depression as a result of stressful life events. So all these children are those who need special care and attention and guidance. So let's see, we have certain things, certain diseases or disorders which are considered, like when you are talking about, when we know that children, people with disabilities, or they are considered as PWD group when it comes to employment, for educational, etc. So they will have certain concessions for job seeking, etc. So the Right of Persons with Disabilities Act 2016 has increased the number of disability conditions from 7 to 21. Earlier it was 7, now 21 disability conditions are recognized for all these concessions, etc. So the updated list of disabilities includes even 3 blood disorders, even acid attack victims are included under this category. That is, they are getting reservations when it comes to jobs, etc. So what are the different 21 disabilities according to the Right of Persons with Disabilities Act? So one is blindness, low vision, leprosy cured persons, hearing impairment, locomotor disabilities, dwarfism, intellectual disability, mental illness, autism spectrum disorder, cerebral palsy, muscular dystrophy, chronic neurological conditions, specific learning disabilities, multiple sclerosis, speech and language disability, thalassemia, hemophilia, sickle cell disease, multiple disabilities including deaf blindness, then an acid attack victim, and the last one is Parkinson's disease. So all these category of people, they get a different reservations and special considerations in government sector, etc. So that is the PWD, or the Persons with Disabilities Act. Now we have to know 3 different terms when it comes to disabilities. Okay, so there are 3 categories. First one is impairment, the second category is disability, third one is handicap. Now for a convenience, we just say it as a disability, but there are 3 levels of it. So let's see. There is the first one is like we have, when you say disability, it's not all people are not equally disabled. The first one is impairment, second one is disability, the third one is handicap. So let's see. Impairment is how, the condition itself, that is blindness, deafness, loss of limb, mental retardation, etc. The disability. Impairment is what happens physically, or what is the problem. That is what is impairment. The disability is what am I incapable of? What am I not able to? Disabled. Okay. I am not able to do something, right? So impairment is something physical. I am blind, or my eyes are not functioning. That is, a physical condition. Now, disability is your inability to do something. So disability is I cannot. So what? As a because as a result of my impairment, I am not able to see. I have difficulty in seeing. And the third one is because of that, I am a handicap. What is the effect of it? That is the handicap. I don't know how to read. Okay. So this is the handicap. Oh, as a result of my disability, I am a handicap, or I cannot read or write. So impairment is deafness. Because of the physical condition of deafness, I am disabled to, I'm not able to hear. I have difficulty in hearing. Because of that, I'm not able to ask for direction. I cannot speak. I cannot hear. Okay. So because of that, that is a handicap associated with it. What is the result of this disability? The third one, impairment, loss of limb. Because of that, I'm unable to walk, or I have difficulty in walking. Because of that, a handicap. Like, how does it affect me? I cannot climb steps. I need a wheelchair. I mean, I need, normal wheel steps is not enough for me. Because when I come to a public place, if it's just, I have an option only about of a flight of stairs, I cannot take the stairs. I need a special, platform for me to walk. I need a ramp. I need a ramp to walk through. There is to take my wheelchair. So I need a special place. So that is what you are not able to use certain. How am I handicapped in the society? That is how am I not able to function as a normal person? Then mental retardation. I don't know how to wear clothes independently. I'm not able to write properly. I'm not able to. So many disabilities are there as part of mental retardation. Because of that, I am totally dependent on others. I need to ask others to help me, so that I can function properly. So let's see what are the different types of disabilities. So the first one is physical. There are lots of categories under physical disabilities. Means physically you have some impairment. Okay, like there are different, like orthopedic impairment by which you are not able to move around. That is like, it can be due to different reasons, like arthritis, rheumatoid arthritis, osteoarthritis, because of multiple sclerosis, muscular dystrophy, crippling from different infections like polio, infantile paralysis, osteomyelitis. Then it could be something congenital malformation, like no, you are born without a leg, or reduced limb function, limb deficiency, absence of limbs, dislocation of joints, or even cleft palate. The facially there, it could be cleft palate, club foot. All the feet are clubbed together. Then traumatic crippling, it can also be due to amputation, like diabetes and all. Because of diabetes, people amputate their legs, right? So such things can also lead to physical disabilities. The neuromotor impairments, because of nervous problem, some problem to the nervous system, like cerebral palsy, spinal cord injury, or spina bifida. This is a case in which, like, there is a folic acid deficiency during the pregnancy. So all this can cause neuromotor impairment. The sensory impairment, some of your sense organs are not functioning properly, like you're visually, you're not able to see, like partial, complete blindness. Auditory, hearing impairment could be lead to partial or complete deafness. Then cognitive or intellectual impairment, disorders of intelligence like mental retardation, becoming a slow learner, Down syndrome. Then neurobiological disorder, attention deficit hyperactivity disorders, autism spectrum disorders. Then pervasive developmental disorders, autism spectrum disorders coming under that, Asperger syndrome, Rett syndrome, disintegrative disorders. So all these are different types of disabilities, and we'll be discussing some of them Then another category is the whole of, speech and language impairment. Then like speech language in some children are, they develop their speech quite late. Could be due to when they are not able to, articulate properly, fluency, they're not able to use words very nicely, they're not fluent, their voice, there's a problem, their language usage, there is a problem, speech disorders like stuttering, they're not able to, when you're talking, so when you're telling some words, you're repeating it like stammering. Then lisping, that sound comes like when you're not able to pronounce, I mean, certain letters, like you're saying types instead of types. Yeah, there are certain children who say, like, they can't say they can't say so that's called lisping. Then esophageal voice, they don't have a clear voice, they have a very cracked voice. Then there are communication disorders, they are not able to express themselves, receptive language disorder, mixed language disorders. Then learning disabilities like dyslexia, dysgraphia, dyscalculia. So out of these, we'll be discussing about the learning disabilities in detail in the later slides. Then psychological disabilities are also there as a type of disability. Anxiety disorder, bipolar, depression, obsessive compulsive disorder, phobias, different types of phobias, schizophrenia. Then different health impairments, chronic illnesses can also lead to disability, like having asthma from long, such children, if they have like chronic asthma and all, they will not be able to function properly. Then cancer, chronic fatigue, diabetes, hypoglycemia, HIV, renal failure, tuberculosis, epilepsy, any cardiac conditions, those things can also lead to disabilities. So let's first discuss about physically challenged children. Now, these children have any type of physical defect or deformity. So that is called as a physically disabled child. That can be due to, genetical, or could be due to, abnormal delivery, during any accidents during the time of delivery. It could be due to any illness, injury. So such children are mentally healthy, they do not have any problem, but due to the physical deformity, they can't adjust to normal life. So there is a chance that they find themselves inferior. Their different characteristics are, they have, of course, the first character is their physical limitation. They are ill challenged because, because of their physical limitations, they're not able to, they might not be able to move their muscles as we can, as normal people can. So many physically handicapped children suffer from a lack of coordination, weak muscles, stiff muscles, no muscle strength, etc. So a lot of therapies are there, like occupational therapy, physiotherapies, etc. They can greatly assist these children so that they can, lessen the handicap, and they can, better cope up with their situations. So they need different equipments to, they can make use of different equipments so that, they can overcome their challenges, like, wheelchair, automated wheelchairs, etc. Then emotional challenges, of course, it's a huge, like when you are disabled or you have some physical challenge, there will be a lot of emotional challenges, especially, even not just the person, their the immediate family members, friends, teachers. So all of them are, they should form a support group. They should always be, they should monitor the physically disabled child's emotional state and give them support, so that they are not, because the physical limitations can lead to frustration, anger, sadness, etc. So the emotional outlook is often directly impacted by the level of support and encouragement that is received from the people around him. So it is very important that the parents, friends, and all will treat them well, so that they don't have any emotional problems. So what are the different causes of physical disabilities? So first one is hereditary problem. So, different, certain hereditary problems can be passed down from generation, like, deafness, dwarfism, speaking, abnormal speaking, then intellectual disabilities, etc. That all those, even physical disabilities can be passed down from the generation. Then certain disease like poliomyelitis, leprosy, these can cause defects to the organs. Then environment, of course, the faulty environment affects the physical, upbringing of the child. If it is in a polluted environment, lack of nutritious food, then improper upbringing, that can also lead to physical disabilities. And even malnutrition can bring about physical disabilities, because certain, we know that minerals, vitamins are all necessary for the growth and development. Like, for example, calcium deficiency can cause rickets, osteomyelitis, etc. So that also can lead to uh, physical disabilities. And accidents, any kind of accident can occur anytime. So, for example, bone fracture, excessive bleeding, burn, amputation, such things, like even a fall during childhood can cause a disability which can last for a lifetime. So all those are the different causes of physical disability. Now, what are the effects of physical disability? Now, first of all, it hampers the physical development of, there are certain skills like which normal children do. So there is chances, they are not able to walk, they are not able to run just like the other children. They're not able to use their muscles as good as the others. Then what about the next one is social rejection. So obviously, a physical disabled child is unable to socialize with normal children because, for example, if all the children are involved in playing a game of football and this physically disabled child is, of course, unable to do that. He's in a wheelchair. He's not able to play like the others. So naturally, he will have less friends because all the other friends are playing around. They can run, they can jump, they can do all those things. But this child cannot do it. So he will, of course, feel socially rejected. So they can't, join sports teams, etc. Then lack of proper aptitude development. They are considered as weak. They are even, they are not, uh, expected much. They are they because they are seen as a burden for the family. Because they most of the time what happens is physical disabled child will be dependent on other family members for their routine activities. So they are not considered as a what do you say, as a person who is capable of income or for supporting the other families, etc. They are considered as weak. So that is, so they will not have enough self esteem, they will have poor self esteem. That is also one thing. Then the society neglects them, so it's very difficult for them to develop confidence, etc. Then because of this, their educational achievements, all that can also suffer. No, so if it's, the physically challenged child can, they have a tendency to achieve less compared to a normal child. And also there are certain, like if you have certain other problems like sensory impairments and all, you need special schools also. Now let's see the certain sensory impairments. The first and the most important one is, I can't say it's the most important. The first one is visual impairment. So it refers to the condition arising due to significant loss of vision. So it includes children who have major vision loss, even if they use corrective glasses. So just because you have short sight or long sight, if you can wear your glasses, that means you're not impaired. Okay, this is without, even with the use of corrective glasses, if you're not able to see well, that is called as a visual impairment. So the nature and degree of visual impairment will also vary from child to child. So there are different levels of this. So according to the International Classification of Diseases, low vision taken together with blindness represents visual impairment. So it includes different categories like moderate low vision, severe low vision, blindness, etc. So we will be considering the, the chart we are all familiar with the Snellen chart. That is the, the chart in which you go to an ophthalmologist. You have a big chart there with the, the big letters. The first letter will be the biggest one, then the small. It comes, in the descending order. That is from the big to the small. So that is like the first letter will be really big, and then the letters become smaller, and the last line will be extremely small. So a person with a good vision or 6x6 vision will see everything clearly. Even the last line with the really tiny lines also, they will be able to read very properly. So that is so this is how usually it is being measured. So that is called as the Snellen chart. Okay. So the standard visual acuity of a person is 20 by 20 if it is expressed in feet, or 6x6 in meters. That is in 6 meters. There is the chart will be kept at a distance of 6 meters, and you are asked to see read the chart. So that is what is that is what you are going to be expected to read all the lines. It will be different lines will be there, and of different size. The first letter will be extremely big, usually it's E, it'll be big, really big size, and then the size of the words will decrease. Okay, and you are expected to read all of them. So next term is field of vision. Field of vision is the area that is visible to the eye when you are looking at a fixed point. Now let's see what are the different categories of visual impairment. So first is blindness. Blindness ranges from being totally without sight to unreliable vision and primary reliance on other senses. Like blindness means it's total, either it is total darkness or being without unreliable vision, means you're completely, something is there, there is light, it's not black, but it's completely blurred. You're not able to, differentiate between things. It's just as a blurred image. Okay. So the legally defined, the Draft Rights of Persons with Disabilities Act of Bill of 2012 says that the blindness ranges from a visual acuity of 20 by 200 in the better eye after correction to having no usable vision or field of vision reduced to an angle of 20 degrees or worse. So it is like 20 by 200 means that is the degree level of visual acuity, which is very sad that, it is like 1 in 100. So you're not able to see, you're just hardly able to see one line. Okay, and that too very blurred. So in the better eye, that is in the both, like you have two eyes. If one eye is functioning properly, that means you're not considered to be blind. Okay. So blindness is even after correction with the help of glasses, etc. You are not able to see better than one line. Then you are considered as a totally blind person. If your one eye is completely okay, and if only one eye is problematic, then you're not considered to be blind. You can function well. You can function as normal people do. So that is what is the difference between a blindness. Then any other, the next one is, so visual acuity of 20 by 200 means that the person can see an object that is normally seen at 200 feet. Okay, only at a distance of 20 feet. That is how normal people see something which is 200 feet. That is 200 feet away. That is how a person with this visual acuity sees when it is kept just 20 feet away from him. Okay, that is what it's like a 10 by 10 when you like seeing something which is, you're just seeing 10% of it. Okay, that is what is a visual acuity of 20 by 200. So the reduced field of vision means they can see just a small line. They can't see peripheral. That is, they don't have a wide view of things. They just have seen a, very limited vision. This is called tunnel. You know how narrow a tunnel is. That's how they can see. They can't see the peripheral sides. That is, they can't see the sides or anything. They just can see on a straight line. They can't see somebody who's on the right or left, etc. So low vision refers to a condition where a person has any of the following conditions, that is visual acuity not exceeding 6 by 18 or 20 by 60 and less than 6 by 60 or 20 by 200. So these are in the better eye with corrective lenses. So no, visual acuity should not exceed 6 by 60. Just like we had mentioned about the 20 by 200, 6 by 60 means, like if the thing is kept at 6 meters from you, just like how normal people see things which are 60 meters away from you, that is how you see things which is kept just 6 meters away from you. Okay, hope it is clear. Something which is kept just 6 meters away from you, but you see it as something which is kept 60 meters away from you. If you are able to see like that, then you say that you have low vision. Okay. And the field of vision is only, the limitation, it's like only 40 degrees. Okay. It's just till 40 degrees angle, you can see the peripheral vision. There is no, you can't see the rest. When you're, like when you are like, for example, this happens especially when you're driving cars. You need good peripheral vision. You need to know if some car is coming from the left or right. then only you will be able to drive it, right? If you have low peripheral vision, you're not able to see the post, which is, or the tree, which is just, which is, you, if you're going to hit the tree or anything, we don't know, because you can see very narrow. All right. So in a car, when you are driving a car, you need good peripheral vision. The field of vision should be good enough. Then only you will be able to see both the sides. Like if you're going to hit the car, or if anything else is there on the road, you need a good field of vision. Now, the next one is, next sensory impairment is hearing impairment. Now, this refers to the condition arising due to significant loss of the sense of hearing. So, children with hearing impairment include those who experience significant loss in hearing, even if they use hearing aids. Okay. So, the nature and degree of hearing impairment will vary from child to child. So, in order to learn effectively, each student with the hearing impairment may require special adaptations depending on the type and degree of hearing loss. Now let's see, there are two terms in hearing that we need to understand first. Just like visual acuity in Snellen and chart, in hearing we have to know the two terms, that is intensity and pitch. Intensity means how loud your voice is, which is measured in decibels. We have heard that, we are human beings can only, we can only hear things up to certain amount, like, so we cannot hear beyond, like, loud noise beyond 120 decibels and all are extremely difficult. So to give a perspective, you can say a whisper is around 30 decibels. When you're whispering, you're just saying some secret to your friend, it's just 30 decibels. A normal conversation, or when you're talking, it's about 60 decibels. And when you're extremely loud, it's around, like, 80 decibels or so. And then you can see the, when you have the really loud sounds, right? Like, for example, an engine starting, such things are like around 95 decibels. Okay. And if you hear a noise, loud noise around above 70 decibels, that's really bad for you. So that is, I hope it's clear what decibels mean and how loud is it. The next one is pitch or frequency. Now, pitch of the sound is measured in hertz. So that is how frequency of the sound. Okay. Now, somebody who's having a very high pitched voice will have a very shrilly kind of voice, while somebody who is having a very soft voice will have a low pitch. Okay. So that is like the vibrations of the sound is more when it comes to a high pitch compared to a low pitch. Okay. So that is measured in hertz. So both these aspects are taken into account when you are considering the hearing loss. Okay. So the hearing loss can be mild, moderate, severe, or profound, depending on the degree of loudness or pitch that the sound that the child can hear. So it can be present in one ear or both the ears, and it can be different types. So there are 3 different types of hearing loss. First one is conductive hearing loss, where the sound is not conducted through the ear properly. Because of that, the sound level is reduced. You know that when you are hearing something, it has to, from the outer ear, it should reach the inner ear, right? So that conduction does not take place properly, resulting in inability to hear low or faint sounds. So this can be corrected through medical procedures. So that is conductive hearing loss. The next one is sensory neural hearing loss. So this has something to do with your sense, or that is your nerves. Okay. So when the inner ear is damaged, or if there is some damage to the nerves that help carry sound to the inner ear, then this problem leads to sensory neural hearing loss. And this is the most common type of permanent hearing loss, because we know that the brain has to process all this information, right? If the nerves which conduct these information to the brain is damaged, then obviously this can lead to permanent damage. Okay. So the next one is mixed hearing loss. This is a combination of sensory neural plus conductive. That is it's not being conducted properly, and also the nerves have certain problems. That is called as a mixed hearing loss. The next is mentally challenged children. A child who's not mentally mature as the children of their age or is less intellectually developed is known as a mentally challenged child. Now, these children are physically fit, they don't have any problem with their physical self, but their intellectual capabilities are less. So, their learning pace is either low or sometimes it can be even nil. So, they have difficulties in socially adjusting. They have other difficulties also. So, let's see what are the characteristics of a mentally challenged child. One thing is bad memory. They don't have a good memory. They have very short term memory recall. When they are when they have to do something repeatedly, they have to do it so many times, then only they are able to recall information. So a person who is normal, they need to study for maybe 1 hour every day, but a person who is mentally challenged, who's a slow learner, they need to learn more. They need to increase the amount of time they need to for memorizing certain things, etc. Then slow learning curve. Now their ability to process new information is also relatively small when compared to other kids. They are not capable of they can't process lot of information at the same time. If you're telling them that the leaf is green, they know they can only process that at that point of time. You can't explain to them photosynthesis, about stomata, about the physical characteristics of leaf, etc. You need to do it in a very step by step manner. You're not able to uh, do lot of you can't explain lot of things at the same time because they have a slow learning curve. So you can slow down the instructions so that they can better receive it. They're not able to receive lot of information at the same time. The next one is attention deficiency. Now these people, what happen is they can't focus for something for too long. They can't focus on a single task for a long period of time. So good way of tackling this deficiency is by making them aware of the most crucial aspect of the work and then building their attention from there on. For example, children, we know that they have less a very short attention span. As we increase in age, as we grow up, our attention span increases. So a small child, if a 3-year-old child, if you're asked to do a task of writing, like an LKG student, if you're making them write for an hour, they're not going to do it because they have really small attention span. You can't expect a child to work for 1 hour continuously. You need to just make them write A and then give them a break because they're not expected to do so much. Okay, so likewise, in attention deficiency is really strong in mentally challenged children. Then disinterest. Because of repeated failures, these children don't trust their skills. Even if they are correct, they feel that they are wrong, they're not able, they're not capable of doing certain things, and they develop disinterest towards studies, etc. So they feel that they don't want to study, they feel that it's a big burden. So that's how disinterest grows in a slow learner or a mentally challenged child. The next one is problem in independent living. So mentally challenged children, they have problems when it comes to doing tasks. They can't stay independent for a long period of time. They can't do their own tasks. They for doing their day-to-day activities, they are not able to dress up on their own. They are not able to brush. They can't follow a routine, etc. So naturally, they need support from another person. Then another problem is inability to restrain emotions. We as people, as individuals, we are expected to we have certain emotions, we are supposed to control certain emotions, right? When being emotionally mature means being able to tackle your emotions in the best possible manner. Suppose you are in a situation where you are feeling very angry, you are in a meeting and your boss is like shouting at you. What are you expected to do? You're going to control your anger, and you're going to behave in a socially acceptable manner. But a mentally challenged child will not be able to think about the consequences and act accordingly. If you feel like throwing certain things on the ground, they do it. They feel like throwing everything or smashing things, they just do it. They don't think about the logic or anything about it. So that is how a mentally challenged child will react to the problem of being inability to restrain emotions. Now coming to the social development, there is chances for bizarre outbursts, poor language skills. They're not able to have good social interactions, to form relationships, maintain friendships, etc. So they will have difficulty in all these aspects. So their social development will be affected to a great extent. Then they're not able to apply new ideas, because naturally their intellectual abilities are poor, so they are not able to think creatively, apply their knowledge, apply their skills in doing certain things. The next is, what are the different causes of mental retardation? The first one is genetic. That is, over 30% of the mental retardation causes are attributed to genetics. They are, different symptoms like Down syndrome, Fragile X syndrome, etc. So that is one problem. Then the next one is head trauma. For example, in like childhood, especially early childhood and all, if a severe the child had endured such severe head injury, that can also cause an inflammation in the brain. Like this can lead to a lot of change in the mental state, lead to difficulties in memory, attention, reasoning, etc. So it's very that is very important that you in the early years, the child should be in a very safe environment, because this head trauma can lead to lifelong problems. Especially you need to be really careful when you are with small children, so that they don't suffer any trauma, especially the head. Then pregnancy related issues, pregnant women who do recreational drugs, smoking, alcohol, they all can affect the brain development of the fetus. Then illness, childhood measles, etc. Encephalitis can cause mental retardation. So even hyperthyroidism in the during birth can also cause poor brain development. Then certain nutritional deficiencies, if suppose you have iodine deficiency in your early childhood, that can also lead to mental retardation. Then exposure to toxic materials like cadmium, mercury, lead, all this can also lead to in a reduction in intellectual growth. So these are the different causes. Now let's see another category of disability, that is learning disability. So learning disabled children are those who suffer from serious learning disabilities. That is, they exhibit natural inferior qualities or capacities in terms of learning or understanding in comparison to their normal children. Okay, so learning disabled is nothing but a sort of helplessness. Like when they are in the academic background, like academic performance is associated, they are not able to function as normal children can. So there are different types of learning disabilities, different areas, for example, dyslexia, dyscalculia, dysgraphia, dyspraxia, dysphasia, auditory and visual processing disabilities, etc. So let's see what all are there. Dyslexia. The word dyslexia stands for reading difficulty. Reading difficulty. When you're not able to read, they can't, they have, difficulty with spellings. Dyslexic persons, they can't read properly. All these letters get mixed up. They're not able to read well. That is dyslexia. Dyscalculia is diminished arithmetic ability. They're not able to do math problems like addition, subtraction. They find it extremely difficult. That is dyscalculia. The third one is dysgraphia. They're having problems with writing. They're not able to write in a line. They're not able to do some especially with different types of writing like cursive writing and all, will be a very huge task for them. Then understanding spelling, such things are very difficult for a dysgraphic child. Then another comes dyspraxia. There is a difficulty in coordination between mind and motor skills. For example, if a child is asked to cut using a scissors, if she's asked to cut a shape, like cut a shape of a triangle or so. So a child is not able to cut the paper in the size, the shape of a triangle, because he's not able to coordinate between his mind and the motor skills. Okay, there is a eye hand coordination is necessary for doing such tasks, or even for showing the way. There are certain for small kids there are different activities, right? Through a maze, you are asked to show the way of to a rabbit to the carrot, something like that. It's very common things you can see in small children's magazines, etc. So the child needs something called as eye-hand coordination. That is, the eye and hand should move in coordination, then only he is able to do it. So a dyspraxic child will not be able to do such things like holding a pencil, writing something. So this is very difficult for them. So that is what is dyspraxia. Next comes aphasia or dysphasia. That is in language comprehension or accent of any particular language. They are finding it so difficult to speak another language, to grasp another language, to understand. So that is very difficult. So that is called as aphasia or dysphasia. So language difficulty. Then auditory and visual processing disabilities. They are not able to, difficulty of normal hearing and vision. So that is what is sensory disabilities. So this also can lead to a learning disabilities. Of course, if you're not able to process visual and hearing, sensory information, you're not able to learn, right? So these are the different types of learning disabilities. So with this, we end the different types of disabilities we have come across, like physical disabilities, then sensory disabilities, mentally challenged children, about learning disabilities, etc. Now let's talk about rehabilitation. Rehabilitation is what is to be done, or what is being done for these special children or these disabled children. What measures are being carried out. So the Constitution of India, in the Indian scenario, the Constitution ensures equality, freedom, justice, and dignity of all individuals, and implicitly mandates an inclusive society for all, including persons with disabilities. So there, like in this, especially in the recent years, that is like the bill is 2016. All those, as we had mentioned earlier, that is the People with Disabilities Act was in 2016. It has included around different categories for reservations, etc. Right. So it has been realized that a majority of people with disabilities can lead a good life if they are given equal opportunities and effective access to these rehabilitation measures. So in India, according to the 2001 census, this is an old data, there are around 2.19 crore people with disabilities, okay, which is around 2% of the total population. So this includes people with all types like visual, hearing, speech, locomotor, mental disabilities. And we can see that 75% of the people who are living with disabilities live in rural areas. And 49% of this are is literate, only 49%. The rest, that is half of the population, of half of the disabled population is illiterate, and only 34% are employed. That is a very small number, right? So we see that they are having they are being they're not getting equal opportunities. That is why they're not employed much. They're not getting enough education facilities, etc., because they feel that the normal school, they're not able to go to normal schools. They're not able to function as normal people. So it is not a very special children or special people. Our society is not really friendly with these people with special needs. So now a lot of emphasis is given on social rehabilitation, that is bringing them to the mainstream. Come on, making them active in the social field, that is giving them equal employment opportunities, giving them reservation for jobs, etc. So what are the different legislations or laws which are there for the persons with disabilities? So the government of India has enacted 3 legislations for persons with disabilities, which are, first one is the Persons with Disability Act, which was in 1995, which provides for education, employment, creation of barrier-free environment, social security, etc. The next one is the National Trust for Welfare of Persons with Autism, Cerebral Palsy, Mental Retardation, and Multiple Disability Act of 1999, which gives provisions for legal guardianships, okay, for people, for creating of environment for such people, so that they have some means of independent living. Now the third one is the Rehabilitation Councils Act of India 1992, with the development of manpower for providing rehabilitation services. So these are the three different legislations completely for the rehabilitation of specially any able or differently able people. So there are 5 rehabilitation centers, that is 4 regional rehabilitation centers and 120 district disability rehabilitation centers, which provides different types of services to people with disabilities. There are also different national institutions which comes under the Ministry of Health and Family Welfare, like National Institute of Mental Health and Neurosciences, Bangalore, that is the NIMHANS. Then Indian Institute of Physical Medicine and Rehabilitation, Mumbai, All India Institute of Speech and Hearing, Mysore, Central Institute of Psychiatry, which is in Ranchi, etc. And also different organizations are also under the state government. 250 private institutions also conduct training courses for rehabilitation. Then National Handicapped and Finance Development Corporation, NHFDC, they provide loans at a concessional rates, so that the disabled people are able to take up self-employment ventures. It's like they are given, for example, for buying sewing machine and any other things, so that they are able to sustain themselves, they are able to earn for themselves, etc. They are given training, special training in certain occupational activities, different, even in certain universities, like departments, they also provide opportunities for children. Like I have we can see there is a lot of exhibitions and all are conducted. So we see that there are for the things which are able, they are given training to make certain things like mats, then mattresses, files, etc. So they can sell it and they can earn the profit. They are given training, special training, so that they are able to manufacture certain things and sell it and get their profits. Then even panchayat institutions, district level institutions, they also are interested with the welfare of persons with disabilities. Now, what are the different measures that are taken? First one is physical rehabilitation. That is, first one is you need to detect it early. Then intervention, counseling, medical interventions, provision of, for example, hearing. If earlier the better, right? So the hearing test is conducted really early on in life. Like I think the first week of after the child is born itself, there is an auditory test is being taken. So the earlier the disability is diagnosed, the better it is. Then it will also include the development of rehabilitation professionals. The next one is educational. First one is physical. The next one is educational. That is, you need to provide them education, especially vocational education, so that they are capable of doing certain jobs. Then economic rehabilitation, so that they can have a dignified life. Like concessions in certain things, like for everything they need concessions, so that they can function as a member of the society. So all the children must education. Coming to special education, we know that all the children with special needs must be enrolled in primary schools. Like they need to get that primary education. So after the assessment of their disabilities by a doctor, a psychologist, a special educator, etc., they will be placed in appropriate educational institutions. So, if a child is having only mild or moderate disability, they can be actually admitted to normal schools. Then if it is severe, they need special schools or remedial schools. So all the children with learning disabilities alone, like if they are having dyslexia, dysgraphia, dyscalculia, etc., they are first managed in normal schools. And then only they can or else they can go to private special schools, etc. So formal schools is there. The Ministry of Human Resource Development has been implementing a scheme of integrated education, that is for the disabled child in the formal schools since 1982. That is, integrated education means they are also being included, okay, in the normal schools, like government schools and all. There is special provision for IEDC, that is intellectually what do you say, challenge children, etc. They are also given education. So special school is a program by the Ministry of Social Justice and Empowerment. Just see this, that is the human resource development is it has introduced the scheme of integrated education for disabled children, IEDC, and under the Ministry of Social Justice and Empowerment, special schools are being there. Okay. So they are usually located in urban areas and mostly run by voluntary organizations, because very rarely the government is funding all the special schools. Usually it is run by voluntary organizations, private organizations. Okay. And most of them are residential also, like boarding schools, etc. And some facilities are provided free of cost. They might be running on charitable under some charitable organizations, etc. So at present, more than 3,000 special schools are there. Approximately 900 institutions are specialized for hearing, 400 for the blind or visually impaired, thousands for mentally retarded, and remaining for children with physical disabilities. So 40% disability of any such particular type is a benchmark for identification and certification. For example, you need to be at least 40% disabled. Then only you can get admission to these special schools. Now, what are the different teaching strategies for children with learning disabilities? Now, children with learning disabilities show great learning when techniques like task analysis, peer teaching, cooperative learning, learning corners, multi-sensory approaches are used. So different techniques can be employed so that, they are being able to learn, especially for learning disabilities. Like, you are using multiple senses, like your hearing, your visual, then when you're using your hands, etc. Different senses are being used, or a learning corner is being set. You have an interesting certain things like flashcards, many things, so that you are you're making them interested in learning. Okay. So different strategies can be helpful for teachers. Like, what are the different strategies? Let's see. So first of all, like, suppose a child is having dyslexia, there is reading difficulty. So you can prepare the student by presenting new concepts and vocabulary, guide the student into reading a story. Okay. And then by asking questions which bring up the purpose or goal of reading. So, making them interested in learning, that is a very important task. That develop or strengthen skills related to materials through different drills or worksheet activities, etc. Then assign work so that they can apply the skills which are acquired during the lesson. Then read to a child aloud to the students. So if they are having difficulty, you can read them stories. You can keep reading them stories so that they are develop an interest. Then devote a few minutes every day to sustained silent reading. Then use different writing activities so that the child there is a opportunity for the teacher to model writing strategies. So these are the different tasks that can be done. So this is just an example for a strategy for reading skills. That is, the main aim behind it is to increase the interest of the child, to improve the or instead of the normal learning pattern, there is a lecture method or just blackboard teaching. The teacher can come up with innovative ideas so that the child feels it's interesting, and they find motivated, they find it easy to do it. They are motivated to do the tasks, etc. So slowly they will be able to overcome their situation. So that is how the teachers and the parents can help in overcoming their disabilities. So hope it is clear. Any doubts?